My name's Irvine. I'm a dermatologist in Our Lady's Children's Hospital and a professor of dermatology in Trinity College, Dublin. So myself and Paulo Mina Osario wrote and reviewed this paper to answer some questions that commonly come up in clinical practice. And the reason that we thought it was timely to do that was because a lot of new data had emerged from sophisticated analysis of large cohorts that began to shed insight into questions that often come up in clinic. One of the commonest questions that will come up is, will my child grow out of eczema? What will their disease trajectory be, if you like, to give it a technical term? How long will they be dealing with this condition? And another question that commonly comes up is, will they have asthma? Will they get allergic rhinitis or hay fever? So we now know from several studies that have looked at very large cohorts applying machine learning techniques to longitudinal studies that discrete clusters of disease phenotypes or endotypes come up time and again. And we have now better information as a result of these multiple studies, which we cite and review in the paper, that can better guide those questions in clinic and give better information to parents. So we might think of the traditional atopic march as a term that was coined a number of years ago, and it has currency and attraction, and that's the child who develops eczema as a baby, subsequently might have food allergies, and then develops asthma, and then finally rhinitis. And these are widely held patterns that have been invested in over years, and people understand them. But what we now know is that kind of linear longitudinal progression through the atopic march from eczema through asthma and hay fever only applies to a small subset of patients. In fact, children who present with eczema in early years can have a number of different disease trajectories. Some of them develop no atopic additional comorbidities whatsoever. Others develop one atopic comorbidity. It may be different from their sibling, and others, their eczema entirely clears up. In spite of the differences in methodology, most large cohort studies reveal similar factors that may predict the risk of disease progression, including higher atopic dermatitis severity, younger age of onset, family history of atopy, polysensitization and/or allergic multimorbidity, filaggrin mutations, and lastly, exposure to an urban environment. At the end of the review, we present several worked clinical scenarios that represent common clinical presentations in clinic and the questions that parents or the primary referring doctor may often raise. We hope that those scenarios allow the application of this large amount of new data to be more readily used in clinic to guide those conversations and to help better answer parental concerns.